part of being a good friend is lending a sympathetic ear. I mean, who hasn't played amateur therapist when a mate's gone through a breakup or lost their job? Friendship's about being there for highs and lows and supporting your mate through tough times. But as a friend, support can only go so far. So what do you say if you think your friend needs help from a professional? Because it can be a sensitive topic. You don't want to lose your friend, but deep down, you're pretty sure therapy is what they need. Well, you're about to hear from a psychologist on this, but I want to hear from you. Have you had to have this conversation with someone? How did you prepare for it and how did it go? Have you ever had to say to a mate, look, I love you, but I think these problems need to be dealt with by a professional? Well, here with me is Christine Bagley-Jones, our resident psychologist. She joins me fortnightly for Head and Heart. Christine, I'm pretty sure this isn't a chat you've had to have with your mates, given that you literally are the professional here.
Actually, it is, because I don't want to be their therapist.
Okay. Talk to me more about this.
Well, friendships are beautiful. And of course, the first port of call when someone's struggling is with their friend. And often that's enough. Just have a bit of a rant and you feel better. But if you're with someone, and the same applies for me, where you can see that issues are bigger than what can be managed in a healthy friendship, the honourable and the most loyal and loving thing to do is often head them in a different direction.
Okay, it's really interesting that you make this distinction between a friendship dynamic and a therapy dynamic. What's a healthy friendship dynamic look like?
Well, reciprocity is key. So where you feel that there's a balance, because the problem if someone is continually sharing their struggles with someone is there's a power dynamic that shifts and you're wearing the same hat instead of it being a shared hat where I might rant about my circumstance this month and then we might swap it out the next month. So if it feels too one-sided, then, that's a bit of a flag.
Do you have your friends look at you sometimes and be like, are you therapying me or are we just having a chat?
Yeah, of course they do. And sometimes they say, look, I'd really be interested in hearing your opinion. And of course, I'm more than happy to share it if it's contained and if it doesn't become too habitual, mostly because it's not a healthy way for a friendship to grow together. But yeah, I mean, obviously any friend that has some sort of expertise, whether it's a mechanic or a cook or whatever, you might often ask for their opinion and it's lovely to be able to offer it.
Yeah, if you're a doctor, someone wants to show you their rash. Have you had clients talk to you about feeling like they want their friends to go to therapy? Like, is this something people bring up in your office?
Yes, and often I even have clients coming and their opening sentence is, my friend suggested I come, or my partner said that there's something going on with me that we're not managing. So it's become very normalised to weave therapy into an idea when friends are, sharing their struggles, if it feels like, because therapy doesn't have to be this last resort. You don't have to wait till the wheels fall off before you maybe suggest, hey, have you thought about talking to someone else apart from just us? As much as I love chatting with you, I'm just wondering if, this is a little bit more complicated.
So when do you know it's time to suggest someone seeks professional help?
Well, it's not an exact science and you don't have to worry about whether you come in too quickly with the suggestion because, as I said, it's not a big deal to get therapy. So I think the signs would be around if it's repetitive, like the same issue keeps coming up, because it means they're not growing or changing or shifting. If it feels complex, like you're listening to it and thinking, there's so many moving parts here, I don't even know how to help, and if it feels intense, where you see that they're starting to struggle in a way that's impacting their quality of life. So it's not just about the burden potentially on the friendship, but, you love your friend and you're watching them just not coping, that would be where you gently start to flag, perhaps we need to get some other input.
Without getting too specific, can you give us a scenario of the sorts of complexity that you might see?
Well, often it's where there's multiple things happening in a person's life, like maybe they're going through a breakup, but then in addition to that, they've got struggles at work, and then they talk about difficulties with the family or their health, and that can be it. Or it could be just one issue that's just really bogging them down. Or it could be what you're looking at as signs and symptoms of depression or anxiety or substance misuse or some big adjustment issue because of a life change. Now, you don't want to ever diagnose a friend, and I've even got to be careful of that, And you don't want to label them where they then may feel judged or feel some shame, because then they're going to shy away from maybe getting any help or even leaning into you, which isn't your goal. But yeah, you want to just start to have more of an open, curious conversation.
You're listening to Life Matters here on ABC Radio National. I'm Teagan Taylor talking to Christine Bagley-Jones for Head and Heart, our fortnightly chat we have about relationships and love and friendship, talking about when it's time to gently suggest to your mate that you love listening to them, but maybe it's time they actually went and saw a therapist, because there's only so much you can do in your friendship. If you've had to have this conversation, I'd love to know how it went for you. If you've got any tips for young players. Heather says, none of my friends ever ask for my support because my advice is usually either take up running or other exercise or see a therapist. This tends to irritate people. On the other hand, they always ask me how to fix their computers. Christine, is there a risk that if you sort of start pointing people to therapy that they're just, not going to stop bringing you their problems altogether?
Well, that's the thing. You want to make sure everything that you do, you couch with love and empathy and be gentle and tactful, because often when someone's coming to you with their issues, they're coming because they trust you and because they feel safe and because, in society we do talk about just how beneficial it is to share with friends. So you need to make sure there's no judgment around what you're saying, and almost like let them know you're there with them still, that the friendship's not changing in that regard. You just want to pivot how you support them. And that support may look like going for walks with them rather than sitting across a coffee table or a bar. And it may be involving, do you want me to help you find your first psychologist? Or do you want me to even drive you there? Like, look at where you can help them in a substantial way so they don't feel like you're just washing your hands of them because they're too difficult.
I'm actually getting some questions for you, Christine, on the text line. This is obviously something that people are dealing with. I might kind of put them to you, sort of rapid-ish fire, like a swift fire. One person says, what about friends who have done or are doing long-term therapy, but there's been little change? In fact, things have gotten worse.
So that's a really good point. And, all therapists aren't created equal, and it's not even about the quality of the psychologist that they might be going to. It might be about the fit. So if your friend is seeing someone and you're not seeing change, you might want to inquire, is your friend being completely open? Are they talking about the elephant in the room? Because often people come for therapy and it takes some time before they disclose the epicenter of the struggle. But it also could be time for a change and get a different therapist. Sometimes people have to trial 3, maybe even 4 different psychologists before they find their one that they can really trust.
Well, Kay is actually asking this very question. How do you find the right therapist? Kay says, myself and family members have had some negative, unprofessional experiences that have left us with trust issues.
Of course. And, my heart bleeds for them because that then sometimes puts them off altogether. You need to maybe listen to word of mouth recommendations, or when you research the therapist, look for, what they say about their approach, what type of experience they've got. And sometimes they're like APRA don't let us have reviews as such, but their Google reviews are something beyond our control. Look at the Google reviews, get a bit of evidence whether they've got the style. And of course, you might have to do quite a few tries before you settle in, but that's okay. It's part of the process as well.
And another question, what about when it is one-sided and they ostensibly want your opinion but really want your agreement, and if you don't agree, they get angry?
Yes, and we can all relate to that. Sometimes if we've got our blinkers on, we don't want to be told the truth. We just want to be having someone, a soft place to land, someone to collude with, which isn't healthy. So I guess you would try different ways to say the same thing if you feel your point is really valid. And if they're not listening, you might just gently point that out. Say, look, I don't know if there's any point in me sharing my opinion because I have, and you haven't really been that interested. So what else can I do to support you here because my words aren't helping? Let them know that you've hit that wall together, and what else can we do? Do we need to bring other people in or change our conversation or the way we're doing it? But you don't want to keep the same pattern of exchange because you're going to start getting resentful yourself.
You really are eliciting quite a lot of questions here on the text line today, Christine. One says, can you please ask what to do if your friend preempts you and says definitely that any suggestion of therapy is unwelcome and unhelpful? They say it has to be anonymous because they listen to RN.
And you know what? That happens too. People have their history or their belief system around therapy. So what I would recommend there as a friend, be curious. Just say why. Like, this is what people are doing now. They're going to their therapist. They're outsourcing it so they can have their best lives and their friendships remain healthy. What is it that's stopping you? And it's often past experience or some sort of negative attitude that you might be able to debunk with a little bit of playful sort of prodding, or look, why don't you just give it a shot, or I know of this person. And if not, maybe start with just giving them a book or going on some sort of course together. Like, there's more than one way to bake a cake.
So, okay, it sounds like this is something that's hitting a nerve with quite a lot of people, maybe a little bit of a script around good phrases and phrases to avoid.
Well, the first thing to avoid is anything that's really pointed, like, I think you need therapy. Right. Don't say that, because suddenly that person may feel triggered to feel shame or guilt, or they may feel like abandoned. So you need to sort of be very gentle in your approach and say things like, start like the sandwich approach.
Yeah.
Start with saying, I love you and I'm there for you. I'm not going anywhere. This issue is pretty juicy and there's a lot to it, and it's not getting better, or you seem really like you're struggling right now. And then you just make the suggestions like, let's work on maybe a different way around this, like getting some help. And I'm there for you and I want to hear what you've got to say. So you've really kept them safe, but you've made it really clear that we need to go beyond this conversation because it's not yielding what they want. And you can also observe and share what you're observing, saying, you just seem tired all the time, or this is always on your mind, or it's been 3 months now. And then that allows them to realise that you're looking at evidence. It's not a personal thing. It's not them that you're judging. It's the issue that you're trying to resolve together.
Christine, it sounds like your friends are very lucky to have you, as well as your clients. Thanks as always for chatting with me.
My pleasure.
Christine Bagley-Jones is our resident psychologist. She joins me fortnightly for Head and Heart. This is Life Matters on ABC Radio National.
Find more great ABC RN stories that take you beyond the headlines on the ABC Listen app.